And welcome to the Dr. Bob Show. How many times a minute does your heart beat? Why does your heart beat? What makes your heart beat faster? What makes it slower? Why does it have extra beats? Why does your heart sometimes get irregular? Is the irregular heartbeat abnormal? Is it harmful to your health? Can it lead to something bad? We'll be talking about the heartbeat and extra beats and rhythm problems. We'll be talking a lot about the most common chronic rhythm disturbance that we have. It's called atrial fibrillation. Very, very common in the United States, and we'll see what's the best thing to do if you happen to get atrial fibrillation. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. My guest is Dr. Josh Todd. Dr. Todd is a board-certified cardiologist, and he deals with irregular heartbeats every single day. He'll be solving our questions. You'll enjoy this show. Stay tuned. We're talking with Dr. Josh Todd, board-certified cardiologist, who we're going to be talking about the heartbeat and some rhythm problems that we can have and what to do about those. Josh, welcome to the Dr. Bob Show.
Thanks for having me again, Dr. Bob.
How many beats a minute does the heart have?
Usually the normal range is anywhere from 60 to 100 beats a minute would be normal. Average is around 70 beats a minute.
What can make the heartbeat go faster?
Your brain has a lot of input on it, so stress, anxiety can make it go faster. Exercise.
So if I get real nervous, my heart rate may pick up a little bit.
Absolutely.
Exercise may do that.
Exercise certainly can do that. If your body needs more energy, needs more oxygen to the cells, heart has to pick up the amount of output that it creates, and picking up the heart rate's a quick way to do that.
How do we make the heart rate get slower? We have to rest or what?
Yeah, sleeping naturally will lower the heart rate. We do have some medications we can use to manufacture that slower heart rate. But yes, relaxation is your body's natural way to slow down the heart rate.
When you look at the heart, how many chambers, as sort of a fixed question here,
Yeah.
Human being has a four-chambered heart. What do you mean by four chambers?
Yeah, there's two top chambers and two bottom chambers. The body likes to separate which amount of blood goes through the lungs and which goes through the body. And so there's two chambers responsible for pumping blood through the lungs and two chambers responsible for pumping blood through the rest of the body.
Which side is responsible to get blood up to the lungs so it can get fresh oxygen?
Yeah, so the right ventricle is what allows us to get blood from our legs, from our head, and all of the unoxygenated blood coming from the organs gets it into the lungs.
So that receives the blood, and the blood is sent up to the lungs, it gets oxygen, goes back to the other side, left side?
Goes back to the left atrium, which is again that top chamber, and then it gets squirted down to the bottom left ventricular chamber, and then out the aortic valve into the rest of the body.
Goes to the nose all the way down to the toes.
Everywhere.
During that period of time, what causes a heart to become irregular?
Yeah, there's a lot of different electrical problems you can have, and especially a lot of them are in the top chamber of the heart.
When you say electrical problems, it makes me think that therefore there's electrical activity in the heart?
Absolutely, yeah. Your heart has some of the fastest nerve conduction tissue in the entire body. So you have what's called a sinus node, which is your natural pacemaker cell, and it's just a stopwatch that will beat 60 to 100 times a minute on average, unless your brain tells it to go faster.
I think it's amazing that it does that. It's such a regular pace there. When it becomes irregular, what does that look like to the doctor? What does it feel like to the patient? How does the patient know if they have an irregular beat?
You know, again, part of it's why is the heart irregular. There's the different types of irregular where it's really chaotic and there's millions of cells firing all at once. Sometimes we have some irregularity where it's just one group or one cell that's firing abnormally and it's competing with your pacemaker cell. So patients will feel palpitations or heart racing episodes, okay, where it feels that they're that they have the irregularity, or they'll feel that their heart's really beating.
Do they sometimes have an irregular heartbeat and the patient can't tell it?
Yes, and we have that vice versa too, and that people think they have an irregular heartbeat and their heart rhythm's extremely normal. So that symptom of palpitations sometimes correlates with abnormal heart rhythms. Sometimes it correlates with your interpretation of what's going on in your body.
So if you look at an electrocardiogram, you're looking at the electrical activity of the heart. If you see an extra beat, is there any extra beat that makes you feel, we better be a little careful here?
Yeah, part of it is stringing a lot of beats together. So things like PVCs, and we start stringing a lot of PVCs, which are bottom chamber rhythms, and that stands for premature ventricular contractions.
Gotcha.
Those extra beats sometimes can occur due to blocked arteries, so I get a little more nervous about lots of those PVCs. Other rhythm disturbances like atrial fibrillation and atrial flutter, which are two close cousins, can give you an increased risk of stroke. So that's why it makes me nervous when I see that on an EKG.
So you got atrial problems, the upper chambers, right and left, and you got the ventricular problem, the lower part, both the right and left, and both can produce abnormal beats.
Absolutely.
Is there ever a time where you feel like you need to slow down those beats?
Yeah, there are two reasons to worry about slowing down beats. One is certainly is if the patient's having symptoms. Symptoms are always a reason in medicine to treat. If you have knee pain, you take ibuprofen to help that. Same thing, if you have extra beats that are annoying to you, we can give you some medicine to help slow it down. Two, if you have an abnormal heart rhythm that's going too fast, over a long period of time, that can weaken the heart. And that's what we worry about sometimes with that atrial fibrillation too.
If the heart beats too fast, too long, at a regular, organized, irregular beat, can people go into heart failure?
Absolutely can, yeah. And usually it's not something that's going to occur over a day or two. Over the course of several weeks, if you're more than 12 to 14 hours in a fast heart rhythm over about 120 beats a minute, you certainly can get a cardiomyopathy or a weakened heart from that.
More common to have problems in the ventricle, the big pumps on the right and left side, or in the atrium, which is the upper chambers.
Yeah, and it's always chicken or the egg with cardiac arrhythmias. Sometimes ventricular problems or pumping problems can trigger atrial problems with the rhythm, and vice versa. So time course can be variable.
So every patient's different. Every patient has to be handled differently.
Absolutely.
And that's what should make the field of cardiology so interesting and exciting, because every person has their own individual heartbeat that may or may not be irregular. Do we have good medicines for irregular heartbeats?
Yeah, and especially for the atrial fibrillation, atrial flutter, or newer rhythm disturbances, which we both have medications and procedures to fix. There's two types of medicines. One will just slow down those heart rate and the speed, and one of them will keep them from occurring. Those are antiarrhythmic drugs, and so those are two different types of medications we can use. Can be if they're not monitored correctly.
If you're working to slow the heart down and make it not do what it wants to, then you potentially could have some problem.
Absolutely.
How do you regulate that? You do repeated electrocardiograms? You run rhythm strips?
We will. When we start people on antiarrhythmics, usually I'll bring them back within a week or so, depending on which medication we choose, to make sure that the patient and the drug are okay with each other. There's a particular medicine that we can use for atrial fibrillation that requires you to be in the hospital for 3 days to start it. So that's a really intense monitoring of that particular medication.
Does that slow down with atrial fibrillation? And we're going to talk about just that in just a minute. Does that slow down the entire heart? What does it do?
No, so again, with the medications that slow down the heart, usually it does work on the sinus node or that pacemaker cell. It can also work sometimes on the extra cells to maybe slow down or decrease the frequency at which they get excited. And then there's something called an AV node, which is kind of the stop sign in the middle of your heart, and a lot of our medications act on that, and that'll block the signal from the top to the bottom chamber.
So there's lots of things you need to coordinate treating in order to get a rhythm problem established to normal. Are there certain people that seem to be more prone to getting rhythm problems, certain disease processes?
Yeah,
and that's what we're going to be talking about when we come back. Why are some people more susceptible to getting irregular heart rhythm? Is it a disease process, or is it something going wrong inside the heart? We're talking with Dr. Josh Todd, and we've been talking about heartbeats, and we've been talking about irregular heartbeats. We've been talking about the big pumps, the ventricles, and the upper chambers, the atrium. Both can cause problems, and we have medicines and ways to detect and guide to straighten that out. Now we're going to talk about why do people get more prone to have rhythm problems or heart disease?
Yeah, there are a number of risk factors, and a lot of them that we can control are environmental. The real answer is genetics, probably, but we can't control our parents. The risk factors we do know for cardiac arrhythmias are the usual for atherosclerosis or coronary disease, meaning hypertension that's uncontrolled, diabetes. The other thing we have figured out is that untreated sleep apnea, if you don't breathe well at night, that interrupted breathing can also trigger more arrhythmias. So we need to be careful if people are snoring and stop the snoring, obstructive sleep apnea. So that can cause damage direct to the heart. Yeah, and it absolutely, the hypoxia or the lack of oxygen in the middle of the night when you stop breathing, heart gets irritable. And a lot of the times that I find that my patients have arrhythmias, the minute we get their sleep apnea treated, the rhythm problems can go away. That should be a great thing to see happen. If you get rid of the snoring and the sleep apnea, that the patient's rhythm problem goes away. What else can cause rhythm problems? There's the historic or classical kind of the term we use is holiday heart syndrome, where
what's that?
And so that's when historically people go to Christmas parties and have a little too much wine during those parties, that can also trigger arrhythmias. So alcohol to an excess can cause a sudden rhythm disturbance, it can or the chronic use of a little bit too much for a longer period of time. Both binge drinking, 1 or 2 servings, not going to, but a binge drinking, defined as 2 or 3 more in an hour, or more than 5 in an evening, certainly can trigger AFib episodes. And I find that if I can get some of my patients to just abstain from alcohol, that gets rid of their heart rhythm disturbances too. Smoking can, certainly. So, and we used to think caffeine did until recent studies showed that caffeine actually reduces the arrhythmia risk now. Now that's good to know, because I like my 2 cups of coffee in the morning. It seems to wake up my brain better. Thyroid disease? Thyroid disease can, if it gets really bad and untreated. So thyroid toxicosis can. So if the thyroid gets overactive, it can bother the heart. How about if it gets underactive? That will cause the heart to become slow, and so we'll get slower heart rhythm disturbances. It can certainly cause your heart to be weak if we have too little thyroid hormone. Thyroid hormone is kind of like the natural caffeine for your body. So you can kind of think of it in that terms. Too much, it's going to stimulate you. Too little, you're going to kind of drag. Let's talk about the most common irregular rhythm in the United States, atrial fibrillation. What does atrial fibrillation mean, and what is it? And then we'll talk about why it's dangerous. Yeah, the atrial fibrillation obviously lives in the atrium, hence the name. It lives typically in the left atrium, or the top up left chamber that's responsible for taking blood out of the lungs. It's a chaotic disturbance of millions of cells. That top chamber is running about 400 times a minute. 400 times a minute. A normal heartbeat's around 70 to 100 somewhere. So even 4 times as much. Right. That must mean it's going so fast it can't really do much. It's going really fast. And if you didn't have that stop sign or that AV node in the middle of your heart, atrial fibrillation would turn into ventricular fibrillation, and we wouldn't be here. So we want to stay here. We want to stay here. So that middle part of the heart regulates it, okay, but it's kind of like it has earmuffs and will only listen to a certain amount of those signals. So that's where you get the irregularity from the atrial fibrillation, and why it's a lot faster, because the top chamber is really driving that bottom chamber rhythm. Does atrial fibrillation vary in the amount of number of heartbeats per minute? Is it different in different people? It can, yeah. Our younger patients tend to have faster heart rates with atrial fibrillation because the bottom chamber accepts more signals. As we get older and our conduction tissue in our heart slows down, those atrial fibrillation rates can naturally slow down on their own. But everybody's different. What are the dangers in general of atrial fibrillation? There's a couple of things that are very important that we try and avoid. Yeah, the biggest risk that I worry about with atrial fibrillation is the stroke risk. So the top chamber, instead of squirting the blood from top to bottom, it's kind of vibrating like a sack of worms. Okay. So when it vibrates like that, the blood becomes stagnant inside it. Exactly. What part of the left atrium does that usually occur in? Yeah, usually at the left atrial appendage is where we'll see the big clots, and that's a tiny little spot on the back of the heart. We can't see see it with our normal ultrasound. But yes, clots can form inside, and then when they form inside that chamber, they travel up to your brain, and they certainly can cause strokes.
So the incidence is about 5 times normal if somebody's got atrial fib that they'll get stroke. So how do you keep a person that's got atrial fibrillation? How do you either get them out of the atrial fibrillation, or how do you make it where they won't have a stroke?
Right. Unfortunately, trying to maintain or getting them out of atrial fibrillation doesn't seem to lower stroke risk. So they're two separate concepts. We worry about the blood thinning medicine we use, and depending on a number of risk factors on whether or not you have congestive heart failure, your age, diabetes, history of stroke, coronary disease, all of those kind of give me a scoring system called a CHAD score that allow me to say, do you need to be on aspirin, or do you need to be on more aggressive blood thinning medicine like Coumadin or some of our newer anticoagulants?
And it's nice to have studies that gives you the information about which type of blood thinner to use in people that have atrial fibrillation due to a different reason. Can you slow the rate down of atrial fibrillation? If my heart rate would be normally 70 and suddenly I'm at 132 and I'm getting a little short of breath when I'm walking with atrial fib, and what do you do to slow it?
Yeah, absolutely. So there's, again, two things we can do. One, I can give you a medicine to slow down the heart rate. Now, it doesn't do anything to the atrial fibrillation. It just works on that stop sign in the middle of your heart. It makes your heart listen to a little less of that upper chamber signal. That will slow it down. For somebody who's not that symptomatic with their atrial fibrillation, we'll use that strategy called a rate strategy. If somebody's symptomatic with it, meaning they have palpitations, they're short of breath when they exert themselves, I'll usually try to get them in normal rhythm. And we do that either with medications or we can electrocute you.
So if you electrocute me, what is that?
Right. So what we do generally, if somebody's in atrial fibrillation, and then they don't go back on their own, we bring them into the cardiac cath lab. We make them sleepy with the anesthesia, and then we put some pads and we do a cardioversion on the patient.
Just like you see on television, so
Exactly.
they go boom.
Yep, exactly.
Do you put so many volts? If the first one doesn't convert somebody, you go a little bit higher?
It does.
Does it almost always convert the heart to normal?
Yeah, we're probably about 90-95% successful. Sometimes I have to change the position of the pads. Sometimes, depending on body habitus or size of patients, we have to get the pads a little closer to the heart.
How long does it last?
Just a single cardioversion in which I do not put you back on drugs, we probably can get some recurrence in about 30 to 40% within the first month or so. If we can put you on antiarrhythmics, we can get that down to less than 20 or 10-15%.
So if I have atrial fibrillation, it's coming from the atrium, the irregular heartbeat, and you cardiovert, you make my heart rate go regular. You got medicines that can keep it that way.
Correct, yes. And that's generally what I'll do for a period of time.
How do you guide the patient at that time? Do you guide them with anticoagulants? Do you guide them by better health habits?
All of the above. So if somebody's first time with atrial fibrillation, we cardiovert, you're certainly going to be on some blood thinning medicine for a period of time in the near term.
How long?
Shocking the heart, it gives you at least a 1 month increased risk of stroke. And so at least a month. If we have somebody who has a lot of those risk factors we talked about, it's lifetime for those blood thinning medicines. And then we'll put you on an antiarrhythmic medication, and depending on your risk factors, control of sleep apnea, blood pressure, all those other factors, we'll kind of see how long maybe we need to keep going.
So it's not just one little thing, it's the whole patient put together that's there. We'll be talking about putting the whole patient together and what we can do to keep that person away from recurrent atrial fibrillation and see what other rhythm problems are common. Wow. We're talking with Dr. Josh Todd, board-certified cardiologist. We're talking about rhythm problems, and then we've gotten into atrial fibrillation, the most common irregular heart rhythm that we have in the United States. We've talked about medicines that can help with the rate. We've talked about cardioversion. Wow. And now we're going to talk a little bit about ablation. What does ablation mean, and how do you do ablation in the heart?
Right. So historically, before we had catheters and mapping software, it would be done at the time of open heart surgery or bypass or a valve surgery, and the surgeon would make various cuts. That maze procedure, we try to recreate that, but less invasively. So we go in with a tiny catheter in the veins, and then we go up to and get over to the left atrium, and then start making tiny burns in the heart at that point.
How long are these tiny burns?
Yeah, the AFib ablations can take anywhere from 3 to 8 hours, depending
So
on.
it's a long-term thing. Is it sometimes hard to find the area that is creating the atrial fib?
Absolutely. In most people, it does occur where the veins that drain the lung come in right around that period, but there can also be some other spots in the atrium. And so we tackle the known places first, and then cross our fingers it works.
Sure. You talked about mapping software. What do you mean by mapping from the inside of the heart?
Yeah, so we normally, before an AFib ablation, we'll get a CAT scan of your body before. That'll give us the size and dimensions of your atrium. We then feed that information into another software into the cath lab, so that we have a three-dimensional, almost kind of a Star Wars picture of what's going on that chamber of the heart.
That must be, watching the advances over a 2 to 5 year period of what occurs, must be exciting and good for the patient, good for the doctor, knowing that both are doing a better job. Talk to me about the Watchman.
Right.
What's a Watchman?
So the that little appendage that we talked about earlier, in which blood clots can form, we do have a plug that can go in there and fit in the atrium of the heart. That plug, compared to taking blood thinning medicine, is relatively equal with most people. The one problem with the plug is not everybody's appendage shape size is the same, and we're trying to take a perfectly round plug and close that area off. So the data on it's good, and it certainly has an indication, but it's not for everybody.
Are you able to visualize the atrial appendage with special x-rays to know if it wiggles the wrong way?
We can. Usually when we put that in, we have both a transesophageal echocardiogram, so it's an ultrasound that we put in your esophagus, and so we look from behind the heart, and we can also use the x-ray that we have in the cath lab to help place that as well.
I think it's amazing. You know, I think it's amazing what you're able to do in order to get rid of a irregular rhythm problem that may create a stroke and may put somebody into chronic rehabilitation, trying to get over the problems with the stroke. Certain improvements in anticoagulants, blood thinners, do they scare people?
Yeah, absolutely, but bleeding scares anybody. The historic drug, the Coumadin or rat poison that we had, requires a lot of monitoring and a lot of blood draws and dietary changes. The newer agents we have, it's kind of a one-size-fits-all for most people, no blood monitoring. The only downside is the cost of these medications right now.
Are they prohibitive? Are the insurance companies cover these medications?
They do. The Medicare donut hole hits everybody at the end of the year, where they have to come out of pocket.
That really makes it difficult on the patient, when it makes it where their medicine, which is important for their life, is unaffordable.
Yep,
you know,
absolutely.
And we're in medicine are trying our hardest to fix that with the insurance companies. Any other advice for somebody that's got rhythm problem disturbances?
Yeah, again, it's control your known risk factors. Exercise always helps. Sleep helps. And if you have sleep apnea, get it treated.
Yeah. And I think the other thing we like of this, we're saying the Dr. Bob shows laughter in your life. It's really socialization that makes the entire body relax, makes it less likely to get medical problems. Josh Todd, you're a wonderful teacher, and you've taken this topic, which I think is really very, very difficult, very, very, very big, and made it down to, hey, if you got atrial fibrillation, see your cardiologist, get it treated, and get it better.
Certainly common. And thanks for having me, Dr. Bob.
Thank you for coming. And remember those things that we like in every Dr. Bob show. Number one is exercise. Why do we exercise? Exercise makes the heart healthy. It actually makes the heart develop new blood vessels to protect itself. It also creates a substance in the lining of the big pumps, the ventricles, which protects the lining of the pump. So exercise is excellent for heart protection and for heart wellness. You are what you eat. You know, if we eat better foods, we're going to lose some of the badness, some of the fat, some of the grease that flows around in our bloodstream. We got to face it. That's what's happening when we eat bad foods. So eat more fruits, eat more vegetables, eat more plant-based vegetables. Look into any kind of food that you get at the grocery store so that you can find how many carbohydrates, how many proteins, how many fats, how many trans fats, all these things that add up and they're important to your health. 7.5 hours of sleep. You know, sometimes we feel, I don't need 7 hours of sleep. I can get by on 3 or 4 hours of sleep. No, you can't. You need that rest, and you need to let your body readjust itself by sleeping good. You'll perform better. You'll have less brain fog. You'll be able to study better. You'll be able to produce better in your job. And most of all, what do we like in the Dr. Bob Show? It's that laughter in your life. Sometimes we forget how much fun it is to sit and laugh with somebody. So who do you laugh with? You find somebody that you tell funny stories about in childhood, or some funny things that you did, or funny things that happened on the news, or funny things that happened on the way to work. There's fun and laughter in your life every day. Take advantage of it. Smile a lot, giggle a lot, laugh a lot, and you will stay healthier.